I'm Ingrid Bergson. I'm the clinical psychologist at the London Orthopaedic Clinic. I think to this point we've spoken very much about the physical journey that patients have had, but I think as Ros was saying earlier, that's really not the whole story, because while people are on this physical journey, they're also trying to live their life. And what we know is life becomes hugely affected from living with a condition such as hypermobility, both in terms of the injuries and the effects of that, but also in terms of the persistent pain that most experience. I'm just going to sort of touch on a few of the areas. It's much, much more complicated and obviously far-reaching than what I'm going to touch on. But just to say that even general activities, anything, and that can range from housework to paid employment, to hobbies, activities, but all the things people take for granted, that people just living with pain and with a condition, when you're trying to do that over the years, becomes really, really difficult. I've never yet met somebody with pain who says they have a fabulous night's sleep. And I think we can often belittle the impact of not sleeping well. If you don't sleep well, you're not rested. Your mood gets affected. Your ability to do your daily tasks becomes harder. And again, over the years, that really can be quite catastrophic. In turn, and what I deal with specifically, is the mood that becomes affected. People are suffer from anxiety, depression, which is often associated with all the losses they may well be experiencing, frustration. They often feel very guilty in the impact this is having on the people around them as well and what they feel they should be doing. And there can be a lot of anger, especially with people with hypermobility, where sometimes the condition is not recognised for many, many years. And what we also know is those moods, there is a reciprocal relationship. So obviously that then can affect your ability to manage the pain and the experience of the pain. What then tends to happen is people often can even find they don't know who they are anymore. Their self-worth, their self-esteem, their whole role and identity can become affected if you can't express your values in a way that's meaningful to you. And on top of all of this, again, as I've said, you don't live in isolation. People live in, whether that's your employers, your colleagues, your neighbours, your friends, your relatives, all your loved ones, it has knock-on effects. And so then people are managing the wider effects of their condition as well. And each one of these feeds in. If you're having a poor night's sleep, you've got difficulty managing your daily activities, that affects your mood. Your mood may affect the next thing and the next thing. And so it feeds in. And these cycles themselves can become very problematic over the years. As it says there, mood and anxiety very commonly linked to pain conditions. It's a reciprocal relationship. One affects the other feeds back in. So we can't just be treating the pain. We can't just look at, while it's obviously incredibly important to be managing the physical pain and the disability itself that may have ensued, what we have to look at is also managing the psychosocial factors and supporting people holistically through the whole of their journey. The thing to also say is that pain is a risk factor in suicide, and it's something, again, we cannot belittle. Specifically with hypermobility, people have, as I said, from a young age, and so their journey may be longer than with other pain conditions. They may have had many years of being disbelieved, told it's just growing pains, and the pieces not put together. When the pieces are put together and they get a label, it also doesn't come with a cure. And that is something else to have to then adjust to. Working as a psychologist within TLOC, I hope that I'm not seen as the end of the line. And I think so often psychology is seen as an end-of-a-line treatment when there's nothing else we can do, go see the psychologist and pull yourself together and find a way of managing your mood. What I would hope is actually that I'm available at any point within the patient's journey, whether that's to help adhere to a medication regime better so they can maximise the way that they're taking their medicines, whether it's to help with their motivation in carrying on with their physiotherapy, whether it is to really help with severe depression because of the number of losses. So at any point in that journey, we have psychological support to support people. Thank you.